Delta variant, which is what we were originally going to get going with this morning. But before we do that, I have Dr. Russell Vinnick, who is our Chief Medical Operations Officer here with U of U Health, who is going to present a quick systems update about our COVID cases and where we're at with that. So I'm going to turn it over to Dr. Vinnick quickly. Thank you.
Good morning, everybody. Russell Vinnick. Thanks for joining us. Wanted to take you through a little bit of our most recent data, as we definitely have seen an uptrend tick in cases at the University of Utah Health. And so just want to start with some statewide data that my colleague Erin Klaus in our Vice President's office has put together. And then we'll talk a little bit about University of Utah Health data, and then happy to answer any questions. So let's start with the first slide, please. So this is data from the state looking at vaccinated by age group, and it's just put it into a nicer graphical form. But the important point here, which I think we all recognize and know, is our population that's under age 50 is significantly less vaccinated than our elderly population. In many ways, that's a great thing that our older population, who's more at risk of hospitalization, has a higher degree of vaccination. And that certainly will help if we see a future surge, but it is also concerning that such a large percent, about 50% of our population in Utah, has not been vaccinated. Not much we can do at this point about people under age 12 since the vaccine isn't available for them, but there is a lot of opportunity in people age 12 all the way up to 60 and 70 who have not yet been vaccinated to improve vaccination. Next slide. I think what's important to look at and keep those first two slides in mind is what we are seeing clearly in this slide is that same population group who's less likely to get vaccinated has been getting more COVID-19. The 25 to 44-year-olds, 15 to 24-year-olds, and even to a small degree, the 45 to 64-year-olds have all seen an uptick in COVID-19 cases, whereas that elder population who has been more vaccinated, we're seeing their cases mostly stable. So very, very concerning that we have a population now that's unvaccinated, and what we would expect and are seeing is a higher number of cases in that population. Next slide. So putting that all together, what you see on the bottom bars is the cases in Utah and the positive tests. And you see those bars in the last couple of weeks, we've seen an uptick overall. The top orange line is total hospitalizations throughout the state. And we've seen that has increased, not a huge number, not what we saw back in November, but is clearly and definitely headed up. And even those critically ill patients and ICU patients, we're seeing an uptick in those cases statewide as well. Next slide. So certainly, similarly, we're seeing an increase in percent positivity statewide. So looking at the two different ways that these tests get reported, one is the people over people, the other is the test over test. We've seen a significant increase in the percentage of positive patients over the last couple of weeks, where we were around 6 to 7%, and now we're close to 9% in that people over people methodology. Next slide. So how has that been at U of U Health? One thing we do at U of U Health is we track very closely not just all patients that we test, but really the symptomatic patients. Those are the people who are most likely to get hospitalized, and particularly as we've seen a lot of changes in testing, not as much pre-procedural testing being done, looking and focusing on symptomatic positive patients has really been a good marker for what to expect in the past. And what we saw was a clear downtrend all the way from December all the way through May. And you see the last week in May, we only had 80 positive tests for that entire week. We've seen a significant climb From that week to the week after, 120. And now this most recent week, which is still not quite complete yet, we're estimating that's going to end up at about 147 positive tests. So a significant, almost a doubling in our positive tests over the last 3 weeks is definitely concerning. And then similarly, we're seeing the same thing with the percent positivity amongst our symptomatic patients, where at the first week of May, we were just over 7%, last week close to 13%. Fortunately, our hospitalizations have been mostly stable at U of U Health. Last 3 days, we've seen a little bit of an uptick. For the most part, for the last couple of months, we've seen under 20 cases a day, or 20 COVID positive patients occupying beds at U of U Health. Just today, it looks like it's increasing a little bit. That's certainly much more manageable than the 100 patients we had in the end of December, but also recognize that hospitals are very busy. As of this morning, our hospital is 100% full. A lot of people who delayed getting care during COVID-19 are getting necessary care now, whether it be cardiac care, cancer care. That is creating a full hospital within our system. And a surge at this point could be much more difficult to manage. The most important point I want to make for all of this is vaccines work. What we've seen, we got some data from the state yesterday, since the end of March, 97% of the COVID positive cases in the state of Utah have been in unvaccinated people. 95% of hospitalizations have been in unvaccinated people. 98% of COVID-related deaths have been in unvaccinated people. Vaccines work. They help prevent infection. They help prevent hospitalization. They prevent death. Dr. Swaminathan's going to talk a little bit about the new variants, but the vaccines are effective against some of these other variants, maybe not as effective as the past, but this is going to be the biggest thing that we can do as a public to prevent the spread and protect other people as well as ourselves, is to get vaccinated. With that, I'm happy to take any questions you all have.
If anyone has questions for Dr. Vinnick, I see there one from Sean. In the past month, the state of Utah seems to be winding down its COVID-19 response, reducing vaccination sites, cutting back on the governor's briefing, and planning to stop reporting daily numbers on weekends beginning next month. Considering what's happening with the Delta variant, do you think that the state winding these measures down is premature? Dr. Vinnick, what do you think about that?
I can't speak for the state. What I can tell you, my interactions with many state officials, is they are watching these numbers very closely and are certainly going to be reactive and be on point. And if things are needed to change, I have confidence that the state will follow the data and do what's necessary.
Another question, which I think we've talked about this a bit in the past as well. What should the state be doing to encourage vaccinations? Offering incentives? What other measures might work as well?
I can't speak to public policy. Certainly, we've seen potential incentives have worked in some states. I'm going to leave it to the policymakers to decide what's the best way to encourage vaccination. Certainly, getting data out to the public, which is what we feel like we can do in healthcare, is number one, be transparent with the data to let people know the safety and efficacy of vaccines. And the other thing that we can do in healthcare is make it available. And certainly when vaccine was not widely available, we were only offering vaccination in a few centers. We at the University of Utah Healthcare have made a big effort to get this available in all of our surrounding clinics, so that people who want to be vaccinated, if they're just coming for a primary care visit, they can usually request a vaccine at that time, and we should be able to get it to them. So this is what we can do in healthcare, and I want to leave it up to the policymakers to what they can do as far as public policy.
One thing, if you could, Dr. Vinnick, because I just want to make sure that everybody heard those numbers that you said at the end of your presentation, and I wrote them down, but if you can just maybe repeat them, and I think maybe the most important message about vaccinations is the percentage that you said of the cases that we're seeing, and I think it was with the positivity rate for the test, 97% of those are among people who are not vaccinated. 95% of our hospitalizations are among those who are not vaccinated. And I think 98% of the COVID-related deaths are among people who are not vaccinated. So I hope I got those right. And maybe if you want to add more context to that, but I think anytime that we can repeat those messages right now, I hope is also helpful in reducing vaccine hesitancy among the public and encouraging people to continue to get vaccinated who haven't been, because I think those numbers are hopefully what will ring true to people right now who have maybe not been sure if they want to get vaccinated, to see that that's where this uptick is happening, if I'm reading that right.
That's all correct, Suzanne. And that is since March 24th, when the vaccine was available to anybody in Utah age 16 and up.
Okay, great. Here's a question from Jed Ball, and I'll let you take this, and then we might also want to discuss this a little further with Dr. Swaminathan when we go into the next topic. How is the race going between variants and the vaccines?
Yeah, I better defer that one to Dr. Swaminathan. What I can tell you is the best way to get ahead of these variants is vaccination. Vaccines cannot mutate when they don't have a host. And that's the best thing we can do. I'll let Dr. Swaminathan comment further about how the race is going.
Okay, well, we'll hold on that for just one second. Sebastian with Univision asks, we were told last year that the Hispanic population was one of the most affected by the virus. Is this still the case, considering a low rate of its population is fully vaccinated? Do we have data on that?
We do have data. I can get you that. I have not looked at it recently. You're absolutely right that the Hispanic population in Utah is less likely to be vaccinated. But I'll have to get you that data.
Okay, and then a question from Roger McDonough. Is there a link between the increase in systematic positive tests documented at U of U Health and the spread of variants?
I'll hit this one briefly and then let Dr. Swaminathan discuss that further as well. Clearly, there's a correlation. We do see increased positives. We are also seeing an increase of the variants within the state. We know that these variants are more transmissible. There's also a lot of other things that have happened in the state. We just had the Memorial Day holiday. We've had a significant loosening in restrictions. Masks have been coming down throughout. It's kind of hard to find somebody wearing a mask nowadays. And so it's likely a combination of all of these things. But I'll let Dr. Swaminathan discuss the implications of the variants. We don't quite have all of the genetic testing that we'd like to have at this point to be able to be very clear how much of this increase is related to the variants versus those other social factors.
Okay, and Dr. Vinnick, I think one last question here that you might have some insight about. Can you talk about what you providers are hearing from patients about why they won't get vaccinated for those who have not been vaccinated yet?
What I have heard more than anything is people are afraid. Sometimes they don't have the right facts. They're looking at facts or hearing facts from friends, from internet blogs, and they are very concerned about the safety of the vaccine. What we know now is the vaccine has been given to hundreds of millions of people throughout the country, throughout the world, and the side effects are minimal, and serious side effects are extremely rare compared to the risk of COVID-19, where we actually don't know the long-term consequences. And we certainly know there's a significant short-term risk of severe illness and death, which we have seen to a degree of 600,000 people plus in the United States.
All right, thanks, Dr. Vinnick. I think that's probably all the questions for you on this portion, so we'll let you get back to what you've got going on today. Let's move into the Delta variant portion. I have Dr. Shankar Swaminathan. He is the Chief of Division of Infectious Diseases here at U of U Health. And then Stephen Goldstein, PhD, is postdoctoral researcher with U of U School of Medicine. So Dr. Swaminathan, why don't we start with you? And I think maybe if you could just introduce a little bit about what we are learning about the Delta variant and just kind of some background on it, where it was first identified, where it has spread, maybe the current situation in the US and what makes this variant different. And I would just say basically what we're learning about it. And then Dr. Goldstein will go over to you as well, kind of what you have learned about it, and what we know and kind of where we're going to go from there, how we can protect ourselves and maybe how it's impacting our population in different ways.
Okay, so this variant was first identified near the end of last year in India, where it has been involved in the really tragic surge in infections that occurred, with millions of people infected and many thousands dying from it. And it is characterized by a panel of change or mutations or changes in the viral genetic structure in its RNA. And this has been associated with greater transmissibility from data in, particularly in Britain. In the UK, it's probably at least 50% more transmissible than previous strains. And while this hasn't been universal, in the UK, it has now become the dominant strain. In other words, most of the cases are thought to be linked to this variant. And it may also be, even though we don't, I think, have hard proof of this, more virulent. That is to say that it can cause more serious disease, hospitalizations, and death. It is not, it hasn't become as dominant in other countries, but there's certainly the possibility that it could occur. And this is a very complex topic as to how likely that is to occur. It depends on a lot of factors, particularly the rate, the prevalence of vaccination in the population. So in India, when the dramatic surge occurred, essentially nobody in the country was vaccinated, maybe 2-3%.
Thanks, Dr. Swaminathan. Dr. Goldstein, what would you say at this point is the most important thing that our population needs to know about this variant? What's the best way that we can protect ourselves? I know vaccine would be the main thing, but what beyond that would you recommend?
Right. So I think, as you said, the main thing is vaccines, and the easiest thing to do, frankly, is vaccines. If you're not going to get vaccinated either right now or ever for whatever reason, you would be advised to continue with the non-pharmaceutical interventions, masking, staying out of crowded indoor spaces, especially, but generally away from crowds, that we've all sort of been asked to do for the last year plus at this point. If you want to not have to do those things and you want to try to avoid becoming infected with SARS-CoV-2, the Delta variant in particular, then you should get vaccinated. And it's important to understand that if you choose not to get vaccinated, ultimately there's a very high likelihood that you will become infected with this virus if the Delta variant becomes dominant. And the information available on the state website suggests that it is on the way to becoming dominant in Utah, if not already dominant. Then your infection is likely to be with the Delta variant, and you're more likely to transmit that to other people than with previous variants. And as Dr. Swaminathan said, some preliminary data that it may be more virulent as well.
So Dr. Goldstein, can you just kind of follow up on that quickly from a layperson's level? How does a virus or a variant of this virus become dominant? Like, how does it mutate in that way so it becomes dominant over the original COVID virus that we saw and that we've been dealing with for the last 15 months?
Right. So when people are infected with a variant that's more transmissible, then over time, the most new infections are going to be caused by the variant that's more transmissible, and other variants that may have been previously present essentially die out. So we're seeing that already occur in the UK with the Delta variant. We previously were very worried about the Alpha variant that became quite prevalent in the UK and then the United States over the winter. In the United Kingdom, where almost all cases were caused by the Delta variant earlier in the winter and spring, almost all cases are now being caused by the Delta variant. And there are indications that the United States is on a similar trajectory. And so the Alpha variant essentially is disappearing as most new infections are caused by the Delta variant. People who recover have some protection for some time, and so they're not susceptible to the Alpha variant anymore, or reinfection with the Delta variant. And so the Alpha variant is disappearing pretty rapidly in the United Kingdom, and the frequency, the percentage of cases that are caused by the Delta variant in the United States seems to be doubling every week or two. So we're on a pretty rapid trajectory here as well. In the past, we know that what's happened in the United Kingdom has sort of foreshadowed what's going to happen in the United States. And I don't think there's any reason to think that this time will be different.
Thank you for that. Dr. Swaminathan, let's go back to the question that Jed Bull had early on. Talk a little bit about the race between vaccine and variants. And I guess another question that we had on Facebook, do we know how effective the current vaccine is against the Delta variant? And I guess what would it take for us to be able to know that in more of a long-term fashion?
Yeah, so the race between the vaccine and the variant, I think, is a very important issue, and I think if you just look at the big picture, the rate of vaccination nationally is slowing, and the goal of getting 70% of the population vaccinated by July 4th looks like it's not going to occur. I think that regardless of what the particular strain is that's circulating most predominantly at any given time, it's going to occur among the unvaccinated, and that's where the spread is going to be. And if you look at Utah statistics for vaccination, it's interesting. If you look overall, it looks like we're not doing very well, because some of the data are presented as the percentage of the population that's vaccinated. And if you look at that, CDC and the media presentations of that data, we're in the bottom 10 of the 50 states. But if you look at it's important, I think, to look at the percentage of people who are eligible, adults and so on. And there, we're not doing so badly. We're right at the middle of where states are. Some of the states in the Northeast and other places are very, very successful, but we're about midway. And the reason for that is we have a very young population. We have a lot of children who are not yet eligible for a vaccine. But as Dr. Vinnick pointed out, the rate of vaccination is lowest in the younger adults. So even if the overall rate of vaccination looks acceptable or promising, the spread occurs in pockets. So if you have a community or an age group or a demographic that's not vaccinated, that's where the spread is going to occur. And if the spread is occurring, I don't know who it was who said it, whether it was Dr. Vinnick or Dr. Goldstein, but mutations occur when there's a lot of virus replication. The mutation occurs every time the virus replicates. And if it doesn't have a new person to infect, that mutation doesn't get transmitted. So when you have ongoing spread in a community, you have more variants and you have selection. And the more transmissible it is, the more you're going to have that spread. And, you know, I think we need to be concerned about groups. There are demographic groups, geographic groups, communities, and students where the rate of vaccination is quite low. And I suspect that we're going to have outbreaks in those groups.
Thanks for that, Dr. Swaminathan. I also wanted to mention to everyone that we have Dr. Paulo Melendez, who is also with our Division of Infectious Disease, who's available to answer questions in Spanish when we're finished up with the questions here in English. I have a couple questions that I want to throw out to both Dr. Swaminathan and Dr. Goldstein to make sure that we cover these. So from Roger McDonough, he wants to know, generally speaking, is it correct to say that the vaccines are effective against preventing the spread as opposed to hospitalizations of the Delta variant? And also, is every individual who isn't vaccinated a potential incubator for the new variant? So which one of you wants to take those two questions?
I can take it if you want.
Yeah.
So the best data we have on how the vaccines perform against the Delta variant comes from the United Kingdom, because they've just had really robust studies looking at variants and vaccines throughout the pandemic. And no question, the vaccines are effective at reducing spread of all the variants, including the Delta variant. The exact magnitude of that reduction for different variants is still probably a little preliminary to pin that down, but it's not the case that if we have the Delta variant spreading, that it's going to spread unencumbered in the vaccinated population. Without a doubt, the more people are vaccinated, the less transmission we're going to have in our community. And I think that goes to Roger's second question as well that I see, which isn't every individual isn't vaccinated a potential incubator? And the answer is yes. A big incubator, though, is our large population of people who are immunocompromised for whatever reason, and who vaccines may not work as well. Those people have the potential to be chronically infected with this virus, and mutations can arise throughout the course of that chronic infection. The way to prevent transmission of variants that arise in just unvaccinated immunocompetent people or immunocompromised people is for it to get as much of the population vaccinated as possible, which I know is sort of a repetitive and not that exciting answer, but it is the answer to a lot of the questions about how to mitigate the impact of this variant and future variants.
So if I could chime in here, I think, you know, while we are very, very happy and, you know, promote the vaccines because they are effective even against the currently circulating variants, I think there's no question that both the immunity from prior infection with the earlier strains, as well as vaccination, is somewhat less effective against newer variants. The vaccines seem to be highly effective against preventing serious disease, hospitalizations, and so on, as you asked, and they are effective against preventing spread as well. But, you know, vaccines are not 100%. They are 90+%. And if you are vaccinated, I don't think it means that you should throw all caution to the wind. If you go into a situation where there's likely to be transmission, so let's say you go into a very crowded grocery store and there's 100 people in there in a small store and none of them is wearing a mask, as I observed this last weekend, there is going to be at least 1 or 2 people in there who are infected. If you look at our current vaccination rate and you notice that no one is wearing a mask, that is not a situation that you want to be in if you're not vaccinated, because it is an airborne virus. And that means that even if you don't come into close contact with the person in the grocery store, that grocery store air is going to have virus floating around in it. And even if you're vaccinated, you may get infected, maybe asymptomatic, that is not know you're infected. Now, this is very, very low likelihood, but I think it's important to remember that the majority of the population is not vaccinated. And we shouldn't just indulge in high-risk behavior, because the people who are not vaccinated are not all doing what they're supposed to be doing. And the other question about, is every individual who isn't vaccinated a potential incubator for new variants? Well, the answer is yes, not just for new variants, but for any viral strain. And the more replication you have, the more mutations are generated. So I think that's where we are. We are going to see dominant strains take over, whether it's the Delta variant or another mutant. The more transmission and replication and ongoing disease we have in the community, this uptick is a little concerning. Hopefully it'll come back under control. So I'll stop there, I think.
Thanks, Dr. Swaminathan. I'm going to throw this question to both of you. I think the answer is probably more in us continuing to discuss the numbers of how effective the vaccines have been, and not necessarily delving into the policy of how to make that happen. But last week, Governor Cox stressed the number of cases, hospitalizations, and deaths since March 23rd who were unvaccinated. His quote was, "These people didn't have to die." Is that kind of messaging, which seems to blame the victims, doing more harm than good when it comes to convincing the hesitant to get vaccinated? Dr. Goldstein, what's your take on that? And is there any different way that we can continue to message to our populations to convince and help encourage people to get vaccinated?
Yeah, I mean, I think what Dr. Cox or what Governor Cox said is true. Whether it's going to be effective or not at convincing people who are hesitant to get vaccinated is, not a virology question. But I think people are not vaccinated or maybe hesitant to get vaccinated for a real variety of reasons. And some of those, the state probably has ways to address, and others are more difficult or more sort of sociological questions. But I'll return to, just a point that I made earlier, which is, choosing not to get vaccinated ultimately is a choice to ultimately become infected with this virus, whether that's next month or next winter or the following winter. And one thing that's concerning about the Delta variant is what we call the secondary attack rate in households, meaning if an infected person brings the virus home, rather than what we saw earlier was about 20% of people in the home would get infected, or 20% of the time the virus would infect somebody else in the home. With the Delta variant, it's around 40%. So if you're choosing not to get vaccinated, and you especially, and this is for people, I think really applies to people who have ample opportunity to get vaccinated, access, the ability to, miss work for a day if they're not feeling well due to the side effects. All of those are concerns. But you're not only going to ultimately get this virus yourself, you're more and more likely now than ever to give it to somebody else in your family, whether that's your kids or your elderly parents or grandparents or whatnot. But I think all of those things need to be considerations that people take into account when they're deciding whether to get vaccinated.
Yeah. So, if you look at why people don't get vaccinated, the reasons really vary from person to person. For many people, it is a lack of access, the difficulty in transportation, or the ability to take time off from work and so on. Others, it's fear of side effects or unknown consequences of the vaccine. There are some who feel that they don't need it and don't see any reason why they should bother. And then there's a percentage of the population that is just never, going to be have an addressable concern. And I think the approach has to be tailored individually, which is where the physicians and the healthcare system and the public health department can have an effect, where we can explain to people in a non-judgmental way, try to address their concerns and ask in an open-ended way what their concerns are about getting vaccinated. For some people still believe that it's going to cost them money because every other interaction that they've had with the healthcare system has cost them money. And that's not the case here. It is free for anyone who wants to get vaccinated. So I think, the approach can be tailored to those different concerns for different groups of people. There's also as Dr. Goldstein pointed out, I keep coming back to this in my own practice, is there are a lot of people who don't have the luxury as we do of being vaccinated and protected. And those are our transplant patients, our cancer patients, patients who are on medications that make them not able to mount a good immune response to the vaccine. And they're at particularly high risk of serious consequences if they get the infection. And the only way that we're really going to be able to protect those people is for the rest of us to get vaccinated.
That's a really good point. I appreciate you bringing that up, Dr. Swaminathan. Another question here that we haven't really talked about that I'd like to address from Kimball Benyon is, Utah has a very young population, including children who are not yet eligible to be vaccinated. Do we have any reason to believe that this variant might affect children differently? Dr. Swaminathan, do you want to start with that? And then Dr. Goldstein, if you have information to add on that, I'd like to hear what you guys have to say about that one.
I think we don't have enough data. There's some anecdotal reports that there might be some unusual manifestations of infection with different variants. And I think we don't have enough data on which children have particularly severe or unusual presentations and what the exact sequences of the viruses are that are causing those. But it's certainly possible that when viruses mutate, they change in their virulence, they change in what organ systems they might affect, in addition to becoming more transmissible.
Dr. Goldstein, do you have anything to add to that one?
I would generally echo that pretty much. From a virological standpoint, I'm a little skeptical of claims that a particular variant, without evidence, and if data comes into the otherwise, to other pointing otherwise, then we'll assess it then. But I'm a little skeptical of claims that a variant is going to become disproportionately dangerous for children. But a variant that's more contagious is going to cause more infections. If it's more virulent in general, if it's more virulent for all populations, that's going to include becoming more virulent for children. And children are under 12, completely unvaccinated now. It's still a pretty small minority of 12 to 18 who are vaccinated. So we have a lot of susceptible children out there right now. And what will happen is that if we do have a surge, this fall, this winter in Utah, those younger populations are going to be hit disproportionately. So whether the variant is particularly bad for children or not, we are looking at a situation where we could see a lot of childhood infections in the fall and winter. And if there are enough infections, there are going to be some hospitalizations and unfortunately a few deaths. We need to vaccinate everyone around those kids until we can start vaccinating those kids.
Another question, I think we've talked about this in a somewhat general way, but we've talked a lot about this variant, how it can impact people who are not vaccinated. What about people who are vaccinated? Does the Delta variant pose increased risk for vaccinated people? What might we know about that, and how big could that risk be to people in the population who are vaccinated?
Yeah, we do have breakthrough cases, so-called breakthrough cases of people who are vaccinated who are infected. Generally speaking, those patients don't get hospitalized or get seriously ill, and that still holds true. However, it's an important question and an interesting question as to what strains are causing those breakthrough cases in vaccinated people. Is it because the vaccine is more likely to allow infection with a variant and so on? I think that's, at least in Utah, I don't think we have the data yet. We'd have to sequence all the breakthrough cases to really know that. That type of work is ongoing, but it's not easy. You have to go in and pull out those cases manually and do the sequencing and analyze the data. So for example, I would estimate that the number of Delta variants are probably around 30% of the new cases right now. So what you would have to do is to have an ongoing sequencing of all the breakthrough cases and see if that percentage is greater than in the general population, i.e., is it 50, 60, 70% of the cases are the Delta variant? And I think we don't have that information yet. It may turn out to be that way. The vaccines are more effective in preventing subsequent infection than prior infection with the virus. And partly that is because the prior infections were with different strains. And so it's important to get vaccinated. The vaccine will prevent infection with the variant as well as other older strains, even if it's a little bit less effective. And to reiterate, whatever strain you get infected with, if you're vaccinated, your chance of becoming seriously ill goes way, way down.
Dr. Goldstein, do you have anything to add to that? And then we'll wrap up with this final question from Sean, and then we're going to take questions in Spanish.
No, I think Dr. Swaminathan covered, all of that quite well.
Okay, great. So Sean means with the Tribune. Oh, you think we're cutting time? Okay. All right. I think we're at time here at 10:30. So we're going to move into our Spanish language section with Dr. Melendez. So Telemundo, Univision, anyone else who is going to ask questions in Spanish, I'm going to turn that time over to them. And I want to thank everybody for joining us today for this interesting topic on the Delta variant. I appreciate you guys all participating this morning, and we are going to move into the Spanish language section. Thank you so much.
Thank you.
Yeah, thank you.
Kimball, do you have any questions?
Yeah, sure. I'll go ahead. Y hablamos con Dr. Meléndez, ¿verdad? Ok, bien. Solamente quiero repetir lo que pregunté en la conferencia de inglés. Tenemos una población aquí en Utah que es muy joven y hablando de este variante Delta, tenemos razón de preocuparnos de cómo este variante puede afectar a niños.
Pues no hay aún tanta información en cuanto a esta particular variante, ¿no? En cuanto a niños. Se ve y es posible, no solamente para esta variante Delta, sino para posibles futuras variantes que se puedan desarrollar, que las diferentes variantes parecen afectar un poco más a la población joven, ¿no? Que es lo que se ha estado viendo últimamente en otros países, que las variantes han causado un aumento en el número de hospitalizaciones en gente más joven de lo que se veía al inicio de la pandemia. Entonces, sin saber exactamente cuánto está afectando la variante Delta a niños en este momento, yo creo que es razonable pensar que mientras nos continuamos moviendo en esta pandemia con nuevas variantes y con otros problemas que puedan venir, hay cierto riesgo de que la población más joven, que ya hemos visto por lo menos en relativamente joven, pero es posible que en el futuro los niños empiecen a tener tal vez un poco más enfermedad severa por COVID, que no se veía tanto al inicio. Entonces, sin decir que necesariamente esta variante afecte más niños, yo no podría excluir que en el futuro otras variantes empiecen a afectar a los niños en una forma más severa. Por eso que es tan importante, pues, y lo hemos repetido tantas veces, ¿no? Vacunar a la mayoría de la población para que no haya tanta chance de que estas variantes se sigan produciendo.
Doctor Meléndez, buenos días, ¿me escucha bien?
Sí, te escucho. Buenos días.
Perfecto, le saludo a Sebastián de Univisión. Buenos días, doctor, si nos puede dar un poco de contexto de variante Delta. ¿Dónde fue identificada? Si es que ya se la ha errado en Estados Unidos y sobre todo si es que ya se la ha errado en nuestro estado de Utah y por qué se localizan como una variante preocupante.
Sí, mira, esta variante Delta se originó inicialmente en India a final del año pasado. Y es una variante que se contagia más, es más contagiosa, parece también producir más casos severos que las originales. Y entonces, como es una variante que es más contagiosa, como sucede con muchos otros tipos de virus, cuando una variante tiende a contagiarse más, entonces empieza a ser la variante que se empieza a convertir en la variante más común en una población. Por eso es lo que llamamos la variante predominante, ¿no? Y eso es algo que ya ha sucedido en el Reino Unido, que ya está empezando a causar, ya es una variante predominante allá, y es una variante que ya estamos viendo aquí en Estados Unidos. Una proporción de los casos de COVID en Estados Unidos y en Utah son debidos a la variante Delta. Y como es una variante más contagiosa, se están viendo un aumento en la proporción de los casos semana a semana en Estados Unidos y en Utah. Entonces, se piensa que en algunas pocas semanas esta variante va a ser la variante predominante en Estados Unidos y también en Utah. Es lo que se predice, ¿no? Y es obviamente un riesgo porque una vez que sea la variante predominante, lo que quiere decir es que la mayoría de los casos que vemos acá en algunas semanas van a ser causados predominantemente por esta variante que pues como estamos viendo parece causar más hospitalizaciones, tal vez más muertes, aunque esta información obviamente cambia o se desarrolla día a día, ¿no? Entonces, pero lo que vemos al momento parece apuntar a que esta variante es más peligrosa en todo ese sentido, en más contagiosa, casos más severos. Y pues si es que realmente se convierte en la variante predominante aquí, podríamos empezar a ver que ya estamos viendo un aumento pequeño en el número de casos y hospitalizaciones, pero esto podría continuar aumentando si es que continúa siendo el caso, ¿no? En algunas semanas.
Dos preguntas muy breves de seguimiento y terminó. ¿Qué tan efectivas son, doctor, las vacunas con las que cuenta ahora el país combatir estas variantes, especialmente del que es la preocupante?
Sí, parece que las vacunas, cuando uno reciba vacunación completa, no solamente una dosis, parece tener un impacto importante en prevenir el contagio por el virus, el original, y también las variantes, incluyendo la variante Delta. Como dije antes, ¿no? Es información que todo esto es nuevo, así que es información que estamos desarrollando de a pocos y todo esto es preliminar, pero con esa información preliminar que tenemos al momento, parece ser que las vacunas tienden a ayudar a prevenir por lo menos enfermedad severa, incluso por la variante Delta, ¿no? Pero parece que también previene de una forma bastante significativa contagiarse de la variante. Pero como ya hemos dicho, ¿no? El efecto no es de 100% de protección. Siempre hay un porcentaje de posibilidad en el que uno se puede todavía contagiar. Si la variante Delta se convierte en la variante predominante, como dije, es 50% más contagiosa. Entonces, aún estando vacunado, si hay mucha gente que no está vacunada y hay posibilidad de que esa variante circule en tu comunidad, va a haber un riesgo si es que uno no está usando máscaras en ambientes donde hay mucha gente sin máscaras y que podrían, bueno, no estar vacunados, aún no usando máscara y no estar vacunado, que no es la recomendación de la CDC, ¿no? Y entonces siempre va a haber un riesgo mucho más pequeño que si uno no está vacunado, pero de todos modos, incluso estando vacunados, hay un riesgo pequeño de que haya, de que uno se infecte por esta variante que es más contagiosa. Entonces, hay que mantener esto en cuenta, ¿no? Uno está vacunado, pero siempre hay que usar sentido común cuando es nuestra propia salud, ¿no? Es algo parecido, pues, para ponerlo en una analogía, ¿no? Usar cinturón de seguridad cuando uno maneja un auto, ¿no? El cinturón de seguridad, pues, se ha visto muy bien que disminuye el número de muertes en caso de accidente, ¿no? Pero eso no quiere decir que ponerse el cinturón de seguridad quiere decir que podamos manejar de forma, pues, sin considerar los riesgos de manejar un auto, ¿no? Es lo mismo. La vacuna definitivamente baja el riesgo de tener enfermedad severa e incluso de contagiarse. Pero cuando se trata de nuestra salud, debemos también usar el sentido común y protegernos, ¿no? En situaciones que parecen riesgosas, con mucha gente en lugares cerrados, nadie usando máscaras, ¿no?
Muchas gracias, doctor. Y mi pregunta final, las restricciones ya se han relajado muchísimo, la mayoría de gente ya pues usa cubrebocas, los que están dados, los eventos masivos ahora en el verano está viendo, y insisto, las restricciones se están ablandando. Esta variante Delta puede darnos a una situación crítica como la que vivimos el año pasado, o estamos lejos de eso, viendo que ya las restricciones se han ablandado demasiado.
Pues es difícil predecir. Yo creo que, pues, a pesar de que no hemos vacunado aún, obviamente, la mayoría de la población que era la meta, tener vacunados a una proporción importante, por lo menos de los adultos mayores, que son los que tienen el mayor número de complicaciones, yo creo que probablemente, aún si tenemos la variante Delta circulando, más probablemente no vamos a llegar a los niveles de infección y de hospitalizaciones que llegamos al año pasado. Es difícil predecir, pero al menos si tenemos a esa población mayor, de adultos mayores cubierta, lo más probable es que no lleguemos a lo mismo del año pasado, ¿no? Pero pues este es un campo que cambia día a día, entonces es difícil hacer predicciones a largo tiempo, obviamente. El problema es que sí, yo creo que sí va a haber un incremento de los casos en las próximas semanas, conforme vemos más la variante Delta en nuestra comunidad. Entonces, aún si no hay tantos casos como el año pasado, podríamos llegar a tener cierto problema con el número de hospitalizaciones y con los casos de repente en adultos más jóvenes, ¿no? Así que hay que estar bien, hay que considerar vacunarse, ¿no? Es lo más importante y hay que tener bastante cuidado, ¿no? En las próximas semanas y ver cómo las cosas van en cuanto a números. Y en cuanto a lo del Estado, pues las restricciones obviamente se bajaron. Yo también estoy seguro, así como se mencionó antes, de que nuestras autoridades de salud van a continuar mirando la información que tenemos y que si es que se empieza a ver un incremento en el número de los casos, es posible que se implementen más restricciones de nuevo. Esto es una situación que cambia todo el tiempo, así que no podemos esperar que un cambio en restricciones se aplique por el resto de la pandemia, ¿no? Es esperable que hayan ciertos cambios, ajustes de acuerdo a cómo vamos. Y yo estoy seguro que van a verlo si es que vemos que el número de casos incrementa de una forma peligrosa para el resto de la comunidad.
Muchas gracias, doctor.
Uh-huh.
All right, if that's it, I think we're going to end it there. Does anyone else have any more questions?
No, thank
right.
you.
Thank you so much, everyone. We appreciate it.
No hay problema. Buenos días.